In today's health check, when you go to the doctor's office, usually you describe your symptoms. They'll run some tests, figure out what's wrong. But now, a new pill may change the way your health problems are diagnosed. Health and science reporter Anya Haneke is here to explain.
And that pill is called the PillCam ESO, or ESO, and it's exactly as the name suggests, a camera in a pill. It's the second PillCam to come out. The first was a few years ago, and it can look inside the small intestine. This one follows the same idea, but it's a little different. It has two cameras instead of one. It has a shorter battery life since it isn't traveling as far, and doctors say it's changing the way we view the esophagus.
Imagine watching a home video of your internal organs with little effort, time, or discomfort. With today's technology, it is possible.
It's a new technology. People are learning about it. More and more gastroenterologists are embracing it.
Dr. Stephen Wiener of Pentucket Medical Associates in Haverhill is one of a very small number of gastroenterologists in Massachusetts offering esophageal capsule endoscopies. It involves a capsule about the size and shape of a large vitamin pill, but inside are two cameras which take pictures of the inner lining of the esophagus.
It's got a little chip, just like a digital camera would have, a little chip that can record the images, and it has a light source on both ends.
Anya, why don't you have a seat?
We decided it would be best to see firsthand how the PillCam ESO, as it's called, works.
This is the recorder. I've already attached the leads to her chest.
Nurse Nancy Salerno hooks me up to a data recorder using 3 sensors.
You can pull the capsule right out of that container.
She gives me the PillCam and a little water. First attempt at swallowing, a failure. The capsule is bigger than expected, but try number 2 is a success.
Oh, I did it.
Nancy slowly increases the incline of the bed to pace the PillCam as it travels down the esophagus.
One more time, don't talk and don't help.
After 8 minutes, the procedure is done, and about 10 minutes later, the results are ready.
Looks pretty normal.
Dr. Wiener fortunately finds no abnormalities.
There's no inflammation. It's a normal appearance.
Typically, he recommends the PillCam for patients with conditions affecting the esophagus, such as acid reflux. He says it is as reliable as a conventional endoscopy, but it doesn't require sedation or recovery and is much less invasive.
I originally was skeptical of it. I thought, how could it really be as good as an upper endoscopy? I didn't believe it, but the image qualities are very good. Patients like it. I've gotten great information, and it's helped me with care of patients. And more importantly, I've gotten a lot of patients who refused to have upper endoscopy. They were happy to do this.
One thing to note about the PillCam, if doctors find anything abnormal during the procedure, they can't do anything about it, such as perform a biopsy immediately, as they can do during a conventional endoscopy. Still, other gastroenterologists we spoke with today say, though many doctors aren't using the PillCam now, it will likely prove to be an important tool in improving screening of the esophagus.
A couple of things. Does insurance normally pay for this procedure?
Insurance is limited on this. The former PillCam that's used to study the small intestine, insurance companies cover that in general, but this one, it's limited for now, but it may pick up.
And now, so what happens to the pill?
The pill passes out naturally within a few days. You hope.
Was it uncomfortable for you? I mean, you went through it. I mean,
It wasn't too uncomfortable. Swallowing it was difficult, but and I could feel it a little bit afterwards, but it wasn't too uncomfortable. It's pretty painless.
All right, Anya, thanks very much.
Sure.